Now, I've just learned from my colleague Jean-Philippe Deneval in France that where he works in Poitiers in France, the radiologists do these injections, these epidural injections. They don't use anesthetic at all. They just use the cortisone.
Mm.
And that's a mistake, because you have the opportunity to, when you're doing these injections, you have the opportunity to determine if you've actually injected the right level or not.
Yeah.
The problem with just doing steroid injection is twofold. One, you don't know if you're injecting the right level,
Mm-hmm.
and you don't know if that patient is getting a systemic inflammatory response or a local anti-inflammatory response. For example, we know from work that was done in Sweden on shoulders. They had a whole bunch. They did a whole bunch of. I think it's 𝐏𝐸𝐸 et al. It was 15 or 20 years ago they did this, and they had these people with shoulder pain, with presumably subacromial pain, like the rotator cuff or bursa, and they injected 50% of the patients. They did a local injection in the shoulder that was painful, and the other 50% they did the same injection into the opposite buttock. And overall, the results were roughly the same. In other words, the steroid injection, regardless of where you inject it, gives a systemic corticosteroid response.